Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. In today's video, I want to talk about probing, okay? This is so important because as I've started working in a new office, I've noticed that some patients haven't been probed for about 4 years. 2 years, 4 years, it doesn't matter. That's way too long because then unfortunately when I do probe those patients and I see, let's just say 5 or 6 millimeter pockets, I'm the one who has to explain to them that they have bone loss and that they need to be coming in every 3 months because their pockets are so deep. And what they end up saying to me if they haven't been probed in a long time is, okay, wait a minute, so what are those numbers again? What do they mean? And why is this the first that I've been hearing about it? So here I am, and I look young. So often patients do ask me, well, how old are you? Like, are you new at this, or what's going on here? Because I've never been talked about these pockets before. So what I simply say is, well, I do have 13 years experience, so no, I'm not new, but thank you. But these numbers, what I'm doing is I'm measuring in between the tooth and the gum tissue. So what I say is, think about it as if you're wearing a turtleneck. So I am probing. So I am taking that little instrument in between your neck and the turtleneck. And with my instrument, I am seeing how far down my instrument can go until it stops. So what I tell them is 1, 2, and 3 means healthy because your toothbrush can reach to about 3 millimeters underneath the gum line at the most. As soon as I see 4 millimeter pockets, 5 millimeter pockets, or more, your toothbrush isn't able to clean that properly, which is why you should now be coming in every 3 months so that I can help you clean that area. And what I tell them is, after we clean that perfectly, it takes about 3 months for all of that bacteria to come up once again to make it gingivitis and perio. So let's say you're coming every 4 months. Well, that's too long because all of that bacteria that makes perio is sitting there and you aren't able to clean it properly. But if you're coming in every 3 months, then we are actually reaching it up to that point where things aren't as bad as it could be. So usually as soon as I say that, they go, whoa, so I have gingivitis and I have periodontitis? What the heck is that? You know, sometimes they have no idea. But what I do tell them, because I don't want them to think that things look so horrible that we can't fix anything, right? So I do tell them, well, if you have gingivitis, that means inflammation of the gum tissue. Now that we can fix. That we can fix to get healthy again. But as soon as you have a bone loss, we can't bring the bone back, and that is periodontal disease. And we can't bring the bone back, but we can prevent the bone from getting worse, okay? And usually as soon as I say that, they go, oh, so if I brush and floss, I am helping things and making it so things aren't getting any worse. And if I come in to see you every 3 months, that means that things won't get worse, hopefully better. But they do have to understand that the bone won't come back, but we need to stop it in its tracks so it doesn't get worse. So what a lot of students and new hygienists ask me is, well, how often do we actually probe? How often should we probe, and why should we probe? So to keep things simple, you should be probing every single year at least, because things can happen in that amount of time. If you're seeing a new patient and you've never seen them before because they're a new patient, you should be probing as well because you need to know what their pockets are. Because if you don't know what the pockets are, how can you clean properly? You know, like how can you get in there to clean the plaque and tartar properly if you don't really know how deep the pockets are? And if you can't have that, I guess, talk with your patients that they need to be brushing this way or that way because their pockets are 4, 5, 6 or more millimeters, you're not really talking to the patient and telling them as much as you should be. It is one thing to say you need to floss every day and you need to brush twice a day, but you need to make it specific to your patient. You know, say, well, you have some 4mm pockets on all of those teeth way in the back. So especially for you, you need to floss every day and brush twice a day. Because if you're not, then those pockets will become deeper and deeper and deeper. And then eventually you can start to lose the bone support that is holding the teeth together. And eventually, those teeth will fall out if there's too much bone being lost. So as a quick recap, if there's a 4mm pocket, you are not losing any of the bone at that point. But as soon as you get to 5mm, you can have bone loss, right? So that's not a good thing. So even for those patients, I say, who do have a 4mm pocket here or there, I do say to them, 4 is almost 5. 1 more millimeter and you are starting to lose the bone support around the tooth. That bone support you cannot get back. And the mouth, you need to have a healthy mouth, guys, okay? And that is what I say to all of my patients. I say it's so important to have a healthy mouth because this starts everything for the rest of the body because you eat and you drink through your mouth. It all starts there. And imagine if you had some teeth missing, if you started to lose teeth, things don't look nearly as nice, and clearly things aren't healthy. So you need to be probing every single year, no matter what. For those new patients, you need to probe at that initial appointment so you know. Do they have perio? Do they have gingivitis? Do they have mild perio? Do they have moderate perio? Do they have severe perio? You need to know these things because if you don't, then how do you really know what to say to your patients? How do you know how to talk to your patients if you don't know what they have, right? So I hope this helped. Any questions, let me know, and I will see you guys in the next video.